Hi, I'm Dr. Joe NIamtu, LoveThatFace.com. I'm a cosmetic facial surgeon in Richmond, Virginia, and I do cosmetic facial surgery from here to here, and I do a bunch of it. I don't do boobs, bellies, or butts, and I'm a teacher, I'm an author, and I'm a surgeon. So I've got a little bone to pick here, okay? This is a New Beauty magazine. It's the Summer-Fall 22 issue, and I've seen the magazine before, and it's kind of a magazine by plastic surgeons for plastic surgeons for the most part. But you know, it's a nice magazine. It's pretty well done, and I think it has some nice articles and some good information in it. But there's a huge problem. Now I have a huge problem with this. This is amazing. Shame on these guys. Listen to it. It says, avoid cosmetic surgeons. That's me. Most doctors who refer to themselves as cosmetic surgeons rather than plastic surgeons do not hold recognized board certifications and may have limited or no plastic surgery training. A major red flag is if the doctor belongs to the American Board of Cosmetic Surgery or any board with the word cosmetic in it. I'm hoping that any reader is not naive enough to believe something like that. So I want to talk a little bit about what's the difference between a cosmetic surgeon and a plastic surgeon. And first of all, let me tell you this. There are a lot of specialties that do cosmetic facial surgery, okay? You have plastic surgery, you have oral and maxillofacial surgery, you have ENT, you have facial plastic surgery, you have ophthalmology, you have dermatology. And it's really all across the board. I have friends that are really good dermatologists, and they do a lot of breast surgery. I have friends that are ENT surgeons, and they do a lot of abdominoplasty and things like that. So you can't just say it's about a specialty, okay? Somebody that does cosmetic surgery, all right, should be judged not by their specialty, but by their training, their experience, and their outcome. So I'm a double boarded surgeon. I'm boarded in oral and maxillofacial surgery. I'm boarded in cosmetic facial surgery. Yes, the American Board of Cosmetic Facial Surgery, which they say you should never go to me. Okay, I have one of the biggest facelift practices on the East Coast. All right, I've done 1,500 facelifts. We usually do one a day. I did 109 last year. I've done over 6,500 blepharoplasties and all kind of other surgeries, and they're saying don't go to me. I mean, really, that's kind of slanderous, okay? So I have friends all over the world that are plastic surgeons, and I have friends that are plastic surgeons that send me patients for my facial expertise. And this is important. You know, I'm not saying anything negative about plastic surgeons, but plastic surgery is a specialty, okay? And they're generally very well educated, broad specialty, but there are many plastic surgeons that don't do cosmetic surgery or don't do any cosmetic facial surgery. I have friends that are plastic surgeons, and they do a lot of reconstruction and cancer and maybe clefts and burns and things like this. They don't do any cosmetic surgery. I have other friends that do a ton of boobs, bellies, and butts. They don't do many faces, okay? And then I have a lot of other plastic surgery friends that do a lot of faces. But just because somebody is this specialty or that specialty doesn't qualify them to kind of own the universe, okay? And, you know, it's kind of funny. You could have a specialist that they say not to go to, like myself, who's been in practice for 30 years, and somebody could go to a plastic surgeon, looking at this article, that's been in practice 2 years. You can't pick a doctor just because the name of their specialty. In your typical residency programs, surgeons that do a lot of facial work are plastic surgeons, oral and maxillofacial surgeons, and ENT or facial plastic surgeons. They split trauma call, they do a lot of cases, and my training, I'll put up against anybody, okay? I did an internship and 4 years of hospital residency, and it's, you know, I've studied the face all my life, and it really bothers me that somebody would say something like that to try and make one specialty look bad, okay? And you know, there's a situation, there's win-win and win-lose, okay? So really true people and balanced people, they're win-win. So if they help somebody else out, that person wins, then they win as well. That's win-win. Then there's win-lose, and we all know people like this, and that's somebody, the only way that they can win is to make somebody else look bad and lose, okay? And that's what this magazine is doing here. It's win-lose. They're trying to make themselves look better while making somebody else lose. What is it about some people that they want to see others fail? They want to demonize their competition. You know, there's enough work to go around for everybody. And honest people would say, you know what? Yeah, there are a number of specialties that do really good cosmetic facial surgery. And you know what? The American Board of Cosmetic Surgery and the American Board of Cosmetic Facial Surgery is a good board, and it's a hard board. And you know, when I took my facial boards, there were plastic surgeons taking that board. And this magazine is discounting, you know, hundreds or maybe thousands of cosmetic surgeons that are members of the American Academy of Cosmetic Surgery and that have taken these boards. And it's crazy, all right? It's just professional jealousy, all right? And a lot of the public don't realize that there are what we call turf wars, okay? So you have plastic surgeons fighting with other facial surgeons. You have cardiologists fighting with interventional radiologists about doing heart procedures. You have orthopedics fighting with neurosurgery about who's doing spine and backs and necks. And you know what? 99.9% of the time, everybody's qualified. You know what it has to do with? It has to do with money, and it has to do with patience, okay? So again, this whole situation trying to say that one group, in this case, cosmetic surgeons and the American Board of Cosmetic Surgery or the American Academy of Cosmetic Surgery, you know, it's so unfortunate. You know why somebody says that? Because they're scared. Because they know that these people do a really good job and they're trying to pull patients away. It just doesn't make any sense, okay? So what's the difference between a cosmetic surgeon and a plastic surgeon, okay? Well, plastic surgeons do many types of procedures, as I said, and many plastic surgeons do cosmetic surgery, okay? But most of them don't do just cosmetic surgery. That's a fact. A cosmetic surgeon, which I am, only does cosmetic surgery. That's all I do. If you come to my office, you're going to see me doing eyelids, facelifts, facial implants, laser, brow lifts, Botox, fillers. I only do cosmetic surgery. And you know what? I'm proud of it. And I teach all over the world. I have courses at my office, and plastic surgeons come to my course. I have one of the most successful textbook series in cosmetic surgery, and some of my contributors in my book are plastic surgeons, and plastic surgery programs use this book. It's one of the largest medical textbooks on Amazon. I have books that have been translated into Spanish, into Chinese. So much of my life is about education. And you look at this magazine and they say, don't go to me because I don't count. Or the hundreds of other people, and maybe thousands, that are in a similar situation. You know, don't drink that Kool-Aid. One of the reasons I think this article is slanderous, because it's totally untrue, and I'm going to read this so I don't misquote it, okay? But cosmetic surgery is well recognized by the American Medical Association. They have a seat on the House of Delegates. All right. The American Academy of Cosmetic Surgery is a bona fide surgical subspecialty that has been recognized by the American Medical Association for over 30 years. The American Academy of Cosmetic Surgery is represented in the Specialty and Service Society Caucus of the American Medical Association and has members who have served on the Plastic and Reconstructive, Facial Plastic, and Cosmetic Surgery Section Council. So how can you say that a society that is bona fide for 3 decades by the American Medical Association, like, don't go to them, don't go to those people, you're making a mistake? Man, that's terrible. Shame on you. So, you know, this whole argument about only certain specialties that can do cosmetic surgery, it's a 40-year-old, worn out, self-serving, thinly veiled way to mislead the public for dollars and for patients, okay? And I want to tell you something. People that have time to argue and write stuff like this, they're not very busy because they'd be doing cosmetic surgery otherwise, all right? And everybody watching this knows that this is an age of diversity and inclusion, all right? Not trying to segregate specialties. It's crazy. And I'm going to give you a couple definitions here, and that's what I think this represents. Again, excuse me for reading, but I don't want to misquote. So I think this is a good example of specialty supremacy, Okay? And if you look at the definition of a supremacist, it is someone supporting the belief that a particular group, especially one determined by race, religion, or sex, is superior and therefore should dominate society, okay? And this has nothing to do with race, religion, or sex, but it's a similar situation. People are trying to have a supremacist view that they should dominate society and the other people don't count. And you know, this sounds dramatic, but it's true. The next word is bigot. Okay, what's a bigot? That's a person who has unreasonably attached a belief, opinion, or fraction, especially one who is prejudiced against or antagonistic toward a person or people on the basis of their membership in a particular group. Okay, now that definition just rings true for this. So supremacy, bigotry, that's not what we want, okay? You know, people should help each other. And I don't care if a specialty says, oh, we're well trained and we do this well. And I mean, that's a brag as much as you want. But don't say that somebody else can't do it, because obviously it's not true. And I'm living proof of that. And I have so many friends that are in the same situation. So every specialty brings something to the table. And I don't care if it's plastic surgery, oral and maxillofacial surgery, ENT, dermatology, ophthalmology, for the greater collective good of cosmetic surgery, all right? And nobody owns the face. No specialty does that. You know why? We share. And there are some great old quotes. We all drink from wells that we didn't dig. We all warm our bones from fires that we didn't start. The bottom line is, a true person, an honest person, a busy person, a secure person will say, of course, other specialties can do this. And shame on you, New Beauty magazine. I mean, I'm still shaking my head. You can do better than this. I think you've got a good magazine, but don't try and mislead the public, because it's supremacy, it's bigotry, and it's not true. And I've proved that. I can prove it all day long. Look at people for what they do, and don't try and say that any group anywhere can't do something. It's just not fair. I'm Dr. Joe NIamtu, lovethatface.com.